you guys are here. I'm really happy to see you all interested in taking care of your voices. So today we'll sing a presentation on vocal health awareness for singers. I am Senobia Smith-West. I am an owner of For Your Voice Music Studio and a singing health specialist out in VANATS, Virginia. Got my Master's of Vocal Pedagogy from Senobia University, and I got my Bachelor of Musicology, but studied classical voice at the Ohio State University. So, a little roadmap of what we're going to talk about today. We're going to introduce why we need to know this, why it's important, some of the things that have been going on in the world with professional voice singers, and how to take care of our voice. We're also going to talk about some of the common vocal health things to do and to avoid to keep your voice going, keep you steady. Some complications that are typical for vocal health singers, and a voice care team, prevention, an interactive demonstration that I'll start with some teachers if there are any teachers in here, and then move on to students. And then, of course, summarize what we talked about.
Chloe, your voice didn't sound Aguilarian at all. Chloe, we're serious. What is wrong with you? I have notes. What? Oh my God. I found out this morning. What are notes? Vocal nodules. The rubbing together of your vocal cords at above average rates without proper lubrication. They sit on your windpipe and they crush your dreams. Isn't that painful? Why would you keep performing? Because I love to sing. Yeah, it's like when my lady doctor told me not to have sex for 6 weeks, and I did it anyway.
You should really listen to your doctor.
The key is early diagnosis. I am living with notes, but I am a survivor. I just have to pull back because I am limited, because I have notes. Chloe, this is horrible.
Well, at least it's not herpes. Auntie, I have that as well.
So, for some of us who've seen this movie, this was giving us some informative information about vocal health issues that can happen for singers. So over the past few years, there have been several canceled tour dates from professional artists like Beyonce, Justin Timberlake, Adele. Everybody's pretty much heard about her vocal complications. Well, these type of things are pathologies that are happening to our voice. Some of them are called nodules. There's also tears and hemorrhages that are very common for vocal health professionals, people who are using their voice actively. So today we're going to discuss a few of those, and then we're going to go through some different exercises to help prevent these things from happening. Usually, if we're taking care of our voice, that really helps working towards building a good vocal hygiene for ourselves. So, when instrumentalists first pick up their instrument, their teachers teach them two things. One, scales, and two, how to properly care for their instrument. Unfortunately, as singers, this is not the case. We rarely see voice teachers or even people at the collegiate level teaching students how to properly care for their voice until something happens. And usually it needs to start from when they start singing, usually at the elementary age. We all have a choir. Some of us have choirs at 4th and 5th grade. The state of Virginia has a lot of competitions. And this would be helpful to teach at those early stages, just like when you're first learning your instrument, how to care for your instrument. Vocal health. So these type of vocal health practices are good for vocal longevity. So what is vocal health? Vocal health is vocal hygiene. To learn how to care for your instrument, to learn how to take care of your instrument, to keep it from getting any vocal pathologies, to learn how to treat your instrument if you have excess mucus, to learn how to prepare your instrument for performance. That is what vocal hygiene and vocal health is. What can we do? Hydrate. Now, for some of you guys probably aren't old enough to have been in the Army, but when I was in the Army, hydrating was the only thing that cured anything to our drill sergeant. Our foot hurt, drink water. That's what they would always say to us. My head hurt, of course, drink water. I break my toe, I stepped on something, I hurt my ankle, drink water. Same with our voice. Hydrate. Hydrating helps. Because like you heard in that video that we just seen, without the proper lubrication, which you need for your voice to function properly, you can get an ailment of your voice. So, things to avoid. Vocal overuse. What is vocal overuse? What do we think vocal overuse is? No? Yes?
Using your voice too much.
Using your voice too much. Yes. Thank you. That was an easy one. What about vocal misuse and abuse? What could that be? Yes.
Pushing your voice too much.
Pushing your voice too much. Okay. What else? Who else raised their hand? Yes.
Using your voice in a way that isn't healthy.
Okay. Yes.
I was just gonna say like screaming and yelling.
Scream. Yes. Yes.
Singing when you're supposed to be on vocal rest.
Singing when you should be on vocal rest. So now that we are all done competing, did we do our warm cool downs? We'll talk about that later. Excessive throat clearing. How do we know that this might be a vocal abuse or misuse? Yes.
That's like slamming your vocal folds together.
Yes, like some of your vocal folds together. How else? What's another? I'm looking for one special thing, one special word. Yes.
Coughing.
Coughing. Yes. Yes.
Like if it hurts, like it's painful.
Especially if it's painful. Especially if it's painful. So, when our vocal folds are functioning properly, they are oscillating. They are vibrating at a certain speed, depending on what pitch we're speaking at, or depending on what pitch we're singing at. If we are clearing our throat excessively, that throws off our natural vibratory pattern. We don't want that. Pretty much. We don't want that. Because when it throws it off, it creates dysfunction. And that is not what we want for our voice, because we want it to work effectively, right? Inhaled substances. First, what could be an inhaled substance?
Smoke.
Yes. Smoke, definitely vaping, yes.
Hairspray?
Hairspray. That is a good one. I was looking for vaping, but that's a good one. Why hairspray?
Because it's sprayed into the air and it can be inhaled,
Mm-hmm.
depending on your position.
But what is in it? What's in hairspray?
It's like stuff that makes stuff like straight and like stick.
Yeah, different type of chemicals that aren't good for our lung function. And as singers, we need our lung capacity, right? Yes. So, inhaled substances. Why is vaping bad? Because some people who vape and they sing, they're like, oh, it's not smoke. It's not smoking. So, why is vaping bad? You guys are so smart. I can tell you take care of your voices. Why is vaping bad? Do you know? What does vaping do? You're inhaling some type of substance, some type of chemicals. What else? Yes.
I mean, I could be wrong, but doesn't it like coat something in your lungs? Doesn't it like alter stuff inside of your lungs?
Yes, definitely. It's altering your lungs, altering your lung capacity, how much you can breathe out when you're singing, and we know we need every little drop we can get. But it also burns your vocal folds. So that stuff that you're inhaling may feel nice and have these great chemicals and stuff that are going on with it, but it's actually burning your vocal folds. And if it's burning your vocal folds, it's drying them out, and it's putting you at risk for vocal health injuries. So, minimize, if you cannot, not vape, or not smoke, or not do anything that involves inhaled substances, minimize it. Don't do it when you have a performance. Don't do it if you know you're coming up to a competition and you want your vocal folds to be at their tip-top shape, okay? If you already know your voice is tired, don't do it. Just minimize when you're going to do it. Caffeine and alcohol. We like caffeine, right? Because I know you guys are way too young for alcohol. Way too young for that. So, both caffeine and alcohol have drying effects to them. And, like we said before, yes?
What about natural caffeines and teas?
That's a good question.
Okay.
That I do not have an answer for. But natural caffeine, natural caffeinated, if it's a low dosage, I'm sure it's fine. But you can tell if you're drinking a lot of it and your voice seems dry, then you know it's having the same effect. But for me, Caffeine makes me crazy. I didn't have any today. Yes.
Except for coffee and tea, what other products that we can ingest contain caffeine?
That's a good
I
question.
know
too.
chocolate does.
Yes.
Energy
Def-
rings?
yes.
How is
Chocolate, those energy bars, anything that has that type of, because caffeine is a drug. Anything that has that drug in it, and especially in excessive amounts, we should all know chocolate does some funny things to our voice anyway before we sing. Dairy does funny things to our voice before we sing. If you know you like those things, don't do it before competition. Don't do it before performance. That's all. Minimize your usage and think smart about when you're going to use it. So some common vocal health complications for singers. So this applies for singers and professional voice users. Professional voice users like teachers or people who do public speaking, those type of things. Phonotrauma. What is phonotrauma? Do we think we know what phonotrauma is? No. So remember how we talked about our vocal folds oscillate? Singing is a phonotraumatic event that we're doing to our voice. So when we are not singing effectively and efficiently, we could potentially cause harm to our voice over time. Obviously, if you just sang a song right now, you're probably fine because you took the proper care, did the proper maintenance to make sure your voice was fine. But if you continue to do it without doing that for a source of amount of time, yes, you could cause your voice phonotrauma. Like in the video we saw before. She had probably been singing, not doing her warm-ups, not doing her cool-downs, just not drinking water, taking care of her health, her body, because our body is our instrument. And eventually, she got vocal nodules. I prefer nodules, not nodes, but, you know, tomato, tomato. So, from phonotraumatic behavior is how these vocal injuries or vocal pathologies are caused. Vocal fold nodules, what we talked about before. Vocal fold polyps. Vocal fold hemorrhages. And muscle tension dysphonia. Now, we will see pictures of 3 of these, but not muscle tension dysphonia. That is actually a video you would have to see. So, who knows what muscle tension dysphonia is, though? Have we heard of that? No. Have we heard of any of these other things other than nodules? Have we heard of polyps? And we've heard of hemorrhages. Do we know how hemorrhages can be caused? All right, we'll talk more about that. But muscle tension dysphonia. So you know how our teachers tell us sometimes we should not sing when we're sick? Or how doing certain things can potentially harm us and we're just like, okay, whatever, you know, because that's how we like to do with adults. Well, the same thing if we break our leg or our foot. Our doctor says stay off of it for a couple of weeks. And he tells us this because when we hurt ourselves, our body magically, because we adapt to survive, our body adjusts to compensate for that injury. And that is the same thing our vocal folds do. And when that happens on the inside, it creates a dysfunction. So when we have a vocal fold injury, whether we're sick and just one side just won't get to the closed phase good enough, we start to use other parts of our muscles of our neck, probably the extrinsic muscles for some, because we usually primarily use the intrinsic muscles. In that case, we can create muscle tension dysphonia because we didn't listen when they told us not to sing when we were sick. So, from what Dr. Miller said yesterday, that you can, if you know you haven't been, if you just have like a minor illness where you just haven't completely lost your voice yet, and you can still do some type of phonation, especially if you can still belt, you can sing. If you cannot belt, you cannot sing. That's how I like to use it for my musical theater students. Because it's great if you can go into your head voice. Usually you can sing your head voice all day. But if you cannot belt, then that's how you know that you have something going on in your voice and you need to stop. Just take your rest. So, sensitive content disclaimer. If any of you guys are squeamish, the next couple of photos might be a little difficult to see. Vocal fold nodules. So, nodules are more like calluses. Like what the girl said before in the video, from your vocal folds rubbing together excessively over time creates scarring and they just build up and build up. Usually it happens medially. So if you ever go to an SOP and you see little ridges in the middle, whoops, of your voice, you know it might be something like a nodule, okay? So, as a result of vocal nodules, you could experience hoarseness. You could experience breathiness because they can't come together. Your vocal folds can't come together all the way. And some pain because you are doing extra. You're creating dysfunction to overcompensate for this voice pathology. Polyps. So, this one is a little bit more gruesome. If we think about polyps, think about them as blisters. So, calluses, nodules are calluses, and polyps are blisters. Both of these things can take years to develop, and you not know. This, I would not have waited something this long. You can feel something. Even though we don't have nerve endings on our vocal folds, you can still feel something there, like something stuck in your throat. You can't swallow all the way, like something like this. Because we're professional voice users, we wouldn't let something like this get so bad. But when something persists for 2 to 3 weeks, like if your breathiness, if you have breathiness for 2 to 3 weeks, if you have hoarseness, raspiness, just your voice just not doing what it needs to do, especially in your higher range, because you can see it's mostly on the tip. If you know your high notes don't sound as clear or don't sound as good as they used to, that is when it's time to go see your voice care team. And we will talk more about a voice care team later. Vocal hemorrhages. So, this right here is where blood vessel burst in this voice. Here you can see there's slight bleeding. So how do we think vocal hemorrhages are caused? Yes? Screaming. Something like this can happen in one instance. Those other things take months, weeks, years to develop. This can happen from just one vocal performance. You know how sometimes they say certain medications can harm us, or certain medications we couldn't take because it makes us more susceptible to injuries like this? This is what happened to Adele when she was singing, where she just lost her voice on stage. This isn't her. This isn't what she looked like, but this is something similar to what happened to her, a vocal hemorrhage. You will lose your voice. This is probably one of the only vocal pathologies where you cannot sing. You'll just lose your voice. It's gone until it heals. Yes?
What would you do for treatment?
Good question. We'll get to that. So, for this, when you're on voice rest, when you have hemorrhages, you go into an ENT and you're just like, they'll check you. They'll see what's going on. They'll tell you don't speak. Don't speak. Voice rest. Don't do anything. You need to rest. This needs to heal. And by the time it heals, they'll go back and check you, see what they need to do. Usually, depending on who you are, probably Adele, she would have had it laserly just fixed. For us, because we don't have Adele money, we probably just would have had to wait longer, get voice therapy, okay, to get it fixed. Because I think at one point, the first time it happened, she said her voice was too pretty, too clean. Her raspiness was gone. So she went back on that thing she was doing to get her voice down and back hard and harsh like it, and beautiful, because we like the sound, like it sounds now. So treatment for something like this is voice rest. Treatment for the other two things, you would get therapy. Usually voice therapists and ENTs, usually ENTs want surgery, but the voice therapist wants you to start building up a routine of practice and exercising your voice. So that's what you would do for those. This, nothing. Rest. That's it. But vocal polyps, you'll start on a regimen because they want to see how you're going to do. Usually voice patients are the most consistent because it's kind of like going to a voice lesson where you sing for your teacher, they tell you what your issues are, what you need to fix, and what we'll work on next time. And that's the same thing with going to a voice health therapist or voice therapist, which is the certified speech language pathologist. You'll go to them and they'll see what's going on. They'll take you through a series of exercises. If it's a singing rehabilitation specialist, they'll do both. at the same time, which is what you want, because obviously we are singers. We want to rehabilitate our singing in addition to rehabilitating our speaking voice. So this one is a combination of a hemorrhage and nodules. And this is just for effect, to let you guys know you can have more than one. They're not picky. So take care of your voice. I like to sing mine twice a year. I don't know if you guys are, but I like to go to my speech language pathologist twice a year and make sure they're still pink and pretty, because we see there's a lot of vascularity in here, and that tells you that you're more prone to hemorrhages. So for women, we have this special time of the month that makes us even more prone to vocal hemorrhages. Usually they tell us we should sing during this time, but we can't help when we get gigs, and we sure can't help when she comes. So we take our time. We know we may not want to do full out belting on this particular day, or we know, oh, we're feeling great today. So like what you're carrying for your voice, you decide what would be good for you at that time, based on you. Now you don't have to tell the director about your issues. You just modify for yourself, okay? Seek vocal help. So a lot of people don't know, and I've had students who've come to me and they'll tell me, oh, I had a surgery, but I didn't do a follow-up, and it was about a year or two ago, but my voice still is not right. And I'm just listening patiently and wondering how they weren't professional. They were just like, oh, I'm singing for the Lord, or I'm singing for fun, but it's not right, and I stopped singing. And I'm like, okay, well, definitely go back and get a follow-up. Definitely see a voice therapist, get some exercises, start working on them, because it's great to have the tools, but if you don't use the tools that they give you, then you won't see improvement. You won't get better. And that's the same with your singing voice. If you don't use the tools your teacher gives you, no matter how much knowledge they're just blessing you with, you will not get better. So, voice care team. An ENT, ear, nose, and throat. So in ear, nose, and throat, you want an MD, board certified otolaryngologist, and board certified in both otolaryngology and laryngology, preferably specializing in the care of professional voice users. So why is it important? Just a board certified laryngologist will say they can help you, but they won't necessarily have specialized training for professional voice user. So I went to one, and when I found out that I had muscle tension dysphonia, that he said, oh, so it's basically you're using your voice like this or carrying your books like this instead of like this. And I'm thinking, oh, so it's technique. I should go to my voice teacher. Wrong. I still need to see a voice therapist. About a few months later, I was like, I'm still having the same problems. And he's like, well, why? Who have you been seeing? My voice teacher? No, you should have seen the voice therapist. You didn't say that. I'm one of the people where you need to tell me exactly what I need to do so I know what to do. Especially being in the military. They told me exactly what I need to do when I need to do it. And now since being there, I'm just like waiting for people to tell me, okay, it's my turn. All right, I will go. So when he didn't tell me that specifically, you need to see a voice therapist, I did not. And I did not get better until I did. It took up several months. I used the tools that I was given, and I was fine. Luckily, most of these are just issues, dysfunctional issues that you can fix with therapy, with help. The next person you want to see is a speech language pathologist. They are not all the same. There's like 8 different types of speech language pathologists. So many that I realized when I had one to come to me who works with children, I'm telling her about these things with voices, and she's like amazed, and I'm amazed. So I'm like, where did you go to school? Didn't they teach you these things? And she's like, no, not this. So you need a voice therapist specifically. They need to be a voice therapist, not just a speech language pathologist. They need to be a voice therapist, a singing rehabilitation specialist. So important. If they are not, run, find someone else. As we know, insurances are different, and you only get a certain kind. Well, if it's your voice, it's an investment you're gonna have to take, especially if it's something that's really important to you. So they need to be MS or MA, board certified in voice disorders, specializing in the care of professional voice users. They are out there. There are a few of them per city, capita, few of them, but they're there. You got to search really hard, but they're there. Finally, you want a private voice teacher, preferably somebody with the knowledge. Most voice teachers do have this knowledge, but they may not be comfortable helping you with your recovery. So in addition to your voice therapist giving you your singing health specialty and helping you recover and giving your exercises, you can take those same things that you're doing and use that as your warm-up in your voice lessons. As she slowly, or he, slowly builds you back up to where you need to be, to your optimal voice. So preferably someone who knows a little bit about disorders or someone who at least knows, is advocate for healthy vocal singing. Are we done? Grabbing this page? All right. Improvement. So, what can we do every single day or a couple of days a week to keep our voice at its best? Warm-ups and cool downs. I'm going to be honest with you. I did not do this in college. I kind of did it in grad school until I found out I needed to do it every single day because I had a vocal health issue. Sometimes that's what it takes for people. I'm one of those people, I'm honest. I was one of those people that it had to happen to me for me to experience it. And the same thing, you know, your parents, they try to teach you their life lessons that they learned. I was one of those who did not care what my mother said. I need to learn it for myself. And unfortunately, I did. So, body movement. What are different type of body movements we could do to help get our voice going as a warm-up? Stretching. Yes, more specifically stretching what? Jaw. Yes.
Or you can stretch your whole body, like your arms, opening up your chest.
Yes. What else? Yes. Your tongue. Good.
The sternum.
The sternum. Yes. Anybody else? What else do you stretch? Yes.
Just massaging your face.
Just massaging your face. Yes. Something else. What else? How about our neck? That's where our laryngeal mechanism is housed, right? It's important for us to stretch that, relax that. What about our shoulders? Why would we stretch or roll our shoulders? Why would we do that?
Improve your posture.
Posture, alignment?
Release
Yeah,
tension.
probably. Tension. Yes, we do everything to release the tension. We may not think we have tension. We may not think or know we have stress. But when things aggravate us, we kind of clench a little bit. When we're scared, we always kind of clench a little bit. And before you start to sing, to remove all that stress and baggage that you experienced that day or that you experienced that week, helps. So it's always important to stretch every part of your body because our instrument is within our body, so we need it. We need to take care of our bodies. Resonant voice therapy exercises. Some of us know what these are. We just don't know they're called resonant voice therapy exercises. Have we heard of semi-occluded vocal tract exercises? Yes. Have we heard of vocal function exercises? Yes. I kind of don't want to say this, but they're all the same. Most of them are all the same thing. You're doing the same things, but they have different purposes, so they call them different things. So when we're working on resonant voice therapy exercises, we are using semi-occluded vocal tract exercises for the purpose of resonant voice, right? And when we're working on vocal function exercises, and we're using for the purpose of resonant voice as well. So you can use them all. They all have different names, all have different functions, but similarly, they are all going to be doing the same thing, warming up or cooling down your voice. Important. Yawn size. Who've done those before? Who likes those? Just saying yawn makes me want to yawn too. Yeah. 'Cause I like to sleep. It's my hobby. And sirens, we love those, right? Why do we our teachers love sirens? Yes. Why do our teachers love
Help
sirens?
stretch out our range.
Yes. Stretch your range. What else could sirens do? Yes.
They allow you to improve your transitions between your head voice and your mix and your cuts.
You're a good student. Yes, exactly. Because that's what I'm listening for. When I say no, just go ahead. Do your sirens. Feel free. Be free. How is she transitioning? Oh, it's getting better. All right. That's what I like to do. See, it's like a check-in for me. The progress. How are you doing? How are you practicing? Because your voice tells on you. You may not know, but your teacher knows. She may not say it, but she knows, and she might be making a note. So, SOVTs, resonant voice therapy exercises, or vocal function exercises, a minimum of 15 minutes a day. Why? Why? What have we been talking about? Vocal health. Yes, as a part of your maintenance for your voice, as part of taking care of your voice. Doing it, yes.
I was just gonna ask, is an hour of vocal practice too much?
So warm up. This is just for the warm up. Your voice will tell you when you're done. If you get tired and you're starting to get that raspy voice like this, that is your cue to cool down. Hopefully you would have started to cool down before then, but if you sound like that, you should definitely cool down. Everyone in here, after the best vocal performance you just did in your entire life, you should have cooled down. 15 minutes. Minimum. You can do more because it's just relaxing you. And the same thing that you're doing to warm up, you can do to cool down. You wouldn't put as much effort into it because you're trying to get more relaxed. You're trying to bring your fundamental frequency back down to neutral. Because after warming up, your pitch has gotten higher. Your speaking pitch may have gotten like 2 notes higher because you've been singing the best you've ever sang in your life. Hopefully, we did that today. Yeah. Yeah.
So 15 minutes warm up, 15 minutes cool down, right?
Minimum.
Okay.
Yes. Yeah. Your voice knows. If you're 5 minutes in, you're like, oh, I don't have more time, and your voice still sounds, keep going. Listen to your bodies. Listen to your voices. They'll tell you. Awareness. Lip trills. We like these, right? Yes.
Should you use different exercises for the warm up and cool down?
You can use the same. You can use the same. Just not as much effort. So I know some singers who like to do lip trills, because we're going to go through practicing some today for our resonant voice therapy exercises, because it is one. Some of us put a little bit too much work into it. It's all about flow in breath. That's what you want. So for the lip trills, if you're doing it properly as a resonant voice therapy exercise, it's a lot of flow. Blowfish. All of these are SOVTs, but they're also resonant voice therapy exercises. Blowfish. Have you ever done those? Have we heard of those? Have you heard of the actual blowfish? Yes. It's like that. You puff out your lips like a blowfish. It's fun. You can try that too. Straw phonation. Yes?
Yes.
Big straws, little straws, everything? How about what I like to tell my students? You puff your lips like you're wrapping your lips around a straw, but you're doing a ooh. And I call it the tight ooh. Have you done those? They're kind of like the buzzy no, because I can't do buzzy no. No matter how much I try, I have to do a modified version. And that's what I do. And then straw and cup phonation. Haven't tried that. Where you put the straw halfway or even just a tip in a cup to see the visual of the bubbles blowing out so you can see how your air is flowing. Have you tried that? Yes? Good. So you guys know how to take care of your voice. Have you been doing it? That's the best question you should ask. Have you been doing it? Another one that I learned when I was in therapy is actually have an empty cup. I wanted to have some today, but I forgot them. But an actual empty cup, similar to how you would use with a straw and cup, and you put your mouth around it, and you talk into it, and this helps you get a really and you focus on your resonance, you focus on your pitch, and you focus on speaking properly, and this helps you get a really resonant voice. Have you tried those before? Okay, I'm about to ask one of the people outside if they can get some cups. Okay, let's demonstration. Who wants to go first? Teachers? Any teachers want to go first? So I guess I'll say this. Any teachers who've seen a lot of neck tension, a lot of overactivity in their students' necks while they were singing or belting and would like to go through some of these resonant voice exercises? No? Nobody's confessing? No? All right, students, who wants to go? Yes, come on up. I thought you were going to volunteer yourself, but I guess not.
I'll volunteer the next one.
Next one?
Yeah.
Okay. So, from what we talked about, which one do you want to try? Since we don't have cups, it's just those two.
Have a clean
Okay.
cup if you wanted to use. We doubled up on stuff.
So, you put the cup around your mouth, and make sure that no air escapes. Okay? And you want to talk at a higher fundamental pitch than your normal. And just say, hello, I'm Annie. Hello, I'm Annie.
Hello, I'm Annie.
Good. Make sure to really type. Hello, I'm Annie. Now do inflections.
Hello, I'm Annie.
Good. Now, see if you can do some woo while you're doing those. Good. All right, keep doing it some more. Good. Now do it nice and easy from the top down. Good. A little easier than that. Good. How's that feel in your voice?
Good. Yeah.
Good. These I like to do as my cool downs because it helps give me some back pressure. It's not the straw where I'm just creating tension trying to do it, especially if it's really tiny. That's a really tiny straw. But yeah, especially if it's a really tiny straw, this is the one. I like to use the cup. It makes my voice feel good. I feel like I'm doing lip trills, but on my voice. Thank you. All right, who wants to try lip trills? Yes, all right, so, piano together like this. Soprano?
Both, all of the above.
Good. Jumping up. Good. Good. Somebody else. She's good. Doing great. Who else wants to go?
More voice?
Yes.
No, we're outside.
Baritone.
Yep. It's baritone.
Good. We're gonna jump up. Good. So your lips are doing a lot of work. We want the air to do the work. Just try it again. We'll go down. Yeah, so use it from here. So just like when you're breathing, you're going to squeeze your abdominal muscles to get the air coming out. Okay? Where were you?
I'll do a side view.
Thank you. So much better. So much more flow. Did you feel it? Did you feel the flow?
Yes, I did, yeah.
Good. All right, going up. Good. See, I like it when we have more cushion because we're able to really use the air. Thank you.
You are.
Who wants to try it? Who else wants to try it? Who wants to try the blowfish?
Oh.
Come on. Have you done the blowfish before?
No.
All right. So. Don't let the air escape. Okay. You're battling. Use it from here. Okay. All right. Let's try soprano, alto. Soprano. We'll start. Same thing. Good, good. So you still want the air to try to escape, but you're keeping it. It's like. Okay. So you're trying to keep your lips as tight as you can, and only minimal air will escape. Good. Roll down. Good. So we're all from here, not from here. You're doing great. Good. Awesome. All right, let's go up higher. Good, good. Do you feel any tightness or tension in yourself?
Maybe.
Good. So it's important to ask questions and tell your teacher if you feel those things, because that's not the goal of the exercise. The goal is to be more free. So let's try it again. Good, good. How's that feel? Good. So for soprano, altos, mid-range, middle range, low range is the easiest. The high range is where we struggle. Especially if you know with your singing, if your higher range has less air than you would like. When you're belting out the note, usually it has the most air. But when you're just gracefully gliding through or just speaking through the notes, it's a little difficult to get the air, which is why it's important to do these exercises. So I like to do these exercises not just for, thank you. So I like to do these exercises not just for cooling down and for warming up, also to help get more flow phonation for my singers, because they are also phonatory phonatory exercises to help get more airflow going. So when I tell my students, we're just struggling to get that air through our belt range or our higher range, let's do these. And we'll just bust out lip trills or blowfishes in the middle of our lesson to try to get more airflow going through. Time, 5 minutes. So the purpose of resonance voice therapy exercises is to get your voice more resonant. When you know that your voice isn't resonating where it needs to be or resonating the way you want it to be, these exercises help. Helps your tone, helps focus your tone, get a better tonal goal, and just helps even out your voice. So doing these consistently, even if you don't sing that day, if you know you have a presentation at school and you're going to speak, it's important to do a warm-up and a cool-down after. Even though speaking isn't singing, it's still some type of vocal activity. So you need to be doing something with your voice, right? Yes. So the objective for resonant voice therapy is to get the strongest voice possible with the least effort. And for someone like me, who grew up not wanting to warm up or cool down, that is optimal. Least effort, because my hobby is sleeping. Sounds good to me, right? So you can imagine, this is all I did was lip trills before I even knew it was called an SOVC. And I wasn't doing it right. But I learned, once I went to resonant voice therapy, how to do it right. Yes?
Is there like a specific time of the day where it's like not as great to warm up? Like if you just woke up at 6 a.m. when the schools kind of get up, is that not a good time to warm
That's
up?
when you should. When you first wake up. Because your voice sounds like, because you've been laying down for 8 to 12 hours. I wish I get 12. I'm not going to lie, I have children. I don't get 12 hours. In my mind, I wish I had 12 hours. Because when you're laying down, all that gunk, mucus, I have an issue with mucus, all that gunk, sometimes your acid comes up. Even if you don't have GERD or acid reflux, a little bit comes up, especially if you just ate before bed, which is why you should not do that. or why they tell you you shouldn't. They tell me so many things. You think I listen? Until I experience it. No. I have to experience it first. So I did. And when I do, that's when I learned how to take care of my voice. That's when my voice got better. So yes, right when you wake up, yes.
Speaking of waking up, I've heard that the voice doesn't wake up until 3 hours after you.
I haven't heard that. That's interesting. If you don't warm up or cool down, yes, your voice is not at the optimal level. Especially, like, I'm not a morning person. I'm not. So I don't really speak in the morning. That's just me, because I'm not ready mentally. And then, but if I warm my voice up, I'm okay. I'm ready. But yes, my voice might still be tired because it's just been relaxing for probably 3 hours. I only got 3 hours. So, yeah. Yes?
If you do your vocals at like late at night, like in the 9 p.m. and on range, does it help, or is that only hurting us because we're tired?
If you've been talking all day and your voice, so like I said, when you are tired, your voice knows. If you're tired, your voice is probably tired. Okay? If you're feeling great at 9 p.m. and you're like, I could sing a medley right now, then that's fine.
Okay.
So it's just listening to your voice. Like with me, sometimes I might wake up at 3 a.m. and I feel great and I might sing, record a video and sing. But sometimes I wake up at 3 a.m. and I'm like, oh, I'm going back to sleep. I'm not ready. So it just all depends on you listening to your voice and you listening to your body. That's what's really important. So, summary. Great. Loved all your questions. Thank you. So, what have we learned? Vocal health. Thank you. Yes, somebody read our slides. What else have we learned? Yes.
There are a lot of different ways your voice can get hurt, and different forms that it can get hurt in.
Yes. And because we're professional voice users, that is important for us to know that we can get hurt. That's the main, that we can get hurt. And then how to prevent it. Yes.
Having a vocal care team is important for getting a professional opinion on how your voice is doing.
Yes. That's number one. Oh, okay, they're all number one. I'm just biased. They're all number one. Voice care team. Because when I got my muscle tension dysphonia, I had no idea that I was supposed to be looking for a board-certified otolaryngologist and laryngologist. I had no idea that I specifically needed a voice therapist and not just an SLP, because there's a difference. Trial and error for me, so you guys can just get it right the first time. Don't be like me. Take my life lessons. Okay. Anything else? What else did we learn? That it can happen to anyone, especially professional voice users who are on tour. Like, especially the celebrities. It happens to all of them at one point in time. Because what do? They have the money. They go out and drink after, go out and party after they have their performance. Not realizing, oh, I got one in 2 days. Your body is not going to recover in 2 days if you've been doing that every single day for months. No, it's not going to recover in 2 days. If anyone needs it, they do. You guys are already good because you got parents moderating you. But now you know, once you go off on your own, how to take care of yourself. Getting that voice care team. Making sure wherever you go off to college, if that's what you look for, just in case. Even if it's just to check your voice. Even if it's just to see, oh, okay, I just want to make sure I'm still pink and my mucosal wave is great. All right. Well, that is all for almost. Oh, we just went through that. Improve your vocal technique. Consider vocal pacing practices, especially if you're in a band and you're performing. If you guys have a manager and they're booking you gigs back to back, maybe every other day. Maybe if you do 2 days, do 1 day off. That's what vocal pacing is. Vocal warm-ups and vocal cool-downs. We know that's important. We should at least be doing that every single day, even if we aren't singing. Because we speak every day, right? We speak every day, so we should be doing warm-ups and cool-downs every day. Consider your dietary habits, especially if you know caffeine makes you a little jittery. Don't have it before a presentation. Or if you know caffeine dries you out. Or if alcohol doesn't apply here. And then seeking out a voice care team. All right. Any more questions? Yes.
I don't know if you have any knowledge of this, but do cough drops like Ricola or
That's a good one. Yes, I thought there's so much to put in a presentation and you only get a limited amount of time. Cough drops. So when I was in undergrad, I took them religiously until I realized they're actually not good for you, especially the kind with the menthol. They will dry you out. But the kind with the honey, no menthol, are good to help soothe. So if you know you feel a little dry, or you just like it just to have something moist. Some people don't like that word, I'm sorry. Or you just like your voice to feel somewhat the illusion of hydrated, then yes, without menthol. Because menthol, it kind of has a little drying effect, and some of them numb you. You won't know if you're at optimal health because you feel great. You're numbed. You might as well have gotten an injection from a doctor. And then you go and sing, and then when it wears off, you're like, oh my God, why am I so much pain? So, numbing, no. Menthol, maybe if you're not going to sing. If you're going to sing, no. Honey, yes. Any other questions? Yes.
So, do you have like any tips of if you're in like a show and you have to sing like every day, how you can like avoid like tiring your voice out?
Warm-ups and cool-downs. Yes. Warm up and cool downs, and probably doing them more. So say you're in a show like on Broadway, and you have an act in the beginning, or you have a solo in the beginning, but then you don't sing again, like a lead until the second act. Cool down, and then warm up before you go sing again. Okay? And then, obviously, minimal talking, voice rest. Voice rest is always key. I love voice rest because it gives me an excuse not to talk to people. My family, they understand. Any other questions? Yes.
Do you have any tips on for like how to sing like out, like project better without straining your voice?
Power source. Your breath. That's how you can sing out. Project. Power source. You have your voice teacher, right? Mm-hmm. Yes. Talk to her about using more breath. What type of breathing techniques did she teach you? Or he?
We do a lot of like trying to like breathe, like get your back engaged in the breath.
The back breath?
Yeah.
The thoracic breath?
Mm-hmm.
And the abdominal breath?
Mm-hmm.
Keep practicing those.
Okay.
Those take years to master. Years to master. What helps is breaking down phrases that you're singing and applying that technique to that particular phrase until you mastered in that phrase. And then move on. And when I say phrase, I mean like maybe you sing Home from the Wiz. When I think of home, that small phrase. Master the rest for that small phrase. Once you got it, move on to the next small phrase. And that's kind of how it works, to help master it, to help you get into the moment. Instead of just trying to do it all at once in one song, you start thinking about other stuff. I think I'm out of time. I don't want to run over. You guys are great.
Thank you.